Creutzfeldt-Jakob.
Creutzfeldt-Jakob disease is a tragic illness, often difficult to diagnose. When we learn that a person has CJD, the first responses are usually fear, confusion, and frustration. A lack of accurate scientific information about CJD has led to confusion even among healthcare workers and funeral directors. In this video, we'll explore the myths and misconceptions that have made people so fearful of Creutzfeldt-Jakob disease. We'll look at CJD and show you what really happens to people who have it. Then we'll talk to the experts and discuss how it can be transmitted and how it can't. In addition, we'll guide you to the CJD Foundation website at www.cjdfoundation.org, where you'll find links to the CDC and other reliable sites which will provide you with research documentation as referenced in this video, as well as detailed information to support all suggested procedures. Armed with these scientific facts, we hope to clear up some of the misconceptions about the disease.
When most folks think of Creutzfeldt-Jakob disease, they think of mad cow, and they flip out.
As you will learn in this video, only cows get mad cow disease, not people.
I don't really know that much about CJD, but everything that I have heard about it, it's highly contagious.
No, it is not highly contagious. But even among funeral industry professionals, that mistaken fear is so strong that patients and families often have trouble getting the service they need. Dr. Ermias Belay is a medical epidemiologist in the Prion Disease Office in the Division of Viral and Rickettsial Diseases at the Centers for Disease Control and Prevention in Atlanta, Georgia. He understands how fear can compromise the sensibilities of funeral industry professionals.
There is a fear factor about CJD because there are a lot of unknowns about this disease. How it occurs, what the agent looks like, and how it could potentially be transmitted. And because there's a lot of unknowns, people potentially may be afraid of the disease or catching the disease.
But after years of careful research conducted by the best and brightest in the world, the data is in, and the message is clear.
CJD cannot be transmitted or has not been shown to be transmitted through the airborne route. The agent does not jump into the air, get aerosolized, and be transmitted to other humans or other patients. Transmission of the CJD agent requires inoculation of brain tissues or nervous tissues coming from a patient with CJD, and the agent has not been shown to be airborne.
The experts agree, but your understanding of this disease is key to eliminating the fear factor surrounding it. The name Creutzfeldt-Jakob disease comes from the two German physicians who first described the illness in the 1920s. CJD is one of a group of diseases called spongiform encephalopathies because of the alterations they produce in the brain. Under the microscope, normal brain tissue looks like this. Large cells like this one are called neurons. There are billions of them. They create tiny electrical impulses that carry messages within the brain. These neurons are delicate. Thousands of chemical processes must work perfectly for them to do their job, and any malfunction can harm them. In CJD, the malfunction involves a protein called a prion protein. Normal neurons have prion proteins covering their surfaces. Normal prion proteins have a molecular shape that looks like this, with most of the molecules organized in spiral formations. In CJD, prion proteins become malformed, and the spiral shapes are replaced by broader sheets. When the abnormal prion proteins come in contact with normal ones, they cause the normal ones to also become abnormal. And that's how the process spreads within the brain. The abnormal prion proteins don't function properly, and they accumulate in the brain. You can see them here, stained brown. Those accumulated prion proteins damage the neurons, and they die. At the same time, tiny spaces appear where there was once normal brain tissue. You can see those spaces as rounded white areas in this image. When the change is fully developed, the brain tissue resembles a sponge, and that's where we get the term spongiform encephalopathy that's been applied to CJD and the diseases that are related to it. But the full name is transmissible spongiform encephalopathy, and the ability to be transmitted is what has caused fear of these diseases. Dr. Paul Brown was a senior investigator at the National Institutes of Health, and he chaired the World Health Organization panel that developed infection control guidelines for transmissible spongiform encephalopathies. He points out the paradox that has given rise to fear of infection.
Although it is a transmissible disease, it is not, in the commonly accepted sense of the word, an infectious disease. And that's an important distinction.
Even if it's not considered infectious in the usual sense, people are still concerned about themselves.
Am I at risk for catching the disease from my husband or my wife or my father or whatever? And the answer is almost certainly no. I'd go so far as to say it's certainly no. You are not at risk.
There are so many myths around this disease.
The CJD Foundation receives many questions from concerned family members who are worried about getting the disease themselves.
We get calls of family members asking us, how do I care for my loved one? Should we put them in a nursing home? Is it contagious? Are we at risk? I have a 5-month-old daughter. Do I take my 5-month-old daughter to see her grandfather? What kinds of things should we be careful of?
By phone, by internet, every day, the Foundation fields a myriad of questions from concerned caregivers and families.
Listen, my wife has been caring for her father, and she's pregnant. Is the fetus in any danger?
My husband has CJD. Can we still have sex?
I was told I have to put her dog to sleep and to burn everything she touched. Is that true?
What about her tears? I've wiped away her tears. Can I catch it that way?
Those are all variations of the same basic question. Can I contract CJD by some kind of exposure to a person who has it?
Casual contact such as hugging the patient, kissing the patient, or being in the same room as a patient, or taking care of the patient, such as washing the patient, for example, or brushing the patient, helping them with the routine personal care. Those types of contacts have not been shown to have transmitted CJD. Contact with bodily fluids have not been shown to have transmitted CJD. The agent that causes CJD is concentrated in the brain and in the nervous tissues. So inoculation of material coming from the brain is required for the disease to be transmitted from person to person.
We've looked for 30 to 40 years for clusters of cases in families. A family presumably has the most intimate contacts that occur in daily living, and we haven't found any transmissions within families for 30 years. So I think that's a fairly persuasive kind of observation.
Statistics prove that physicians, healthcare professionals, funeral directors, and embalmers have no greater risk of contracting CJD than the general population. If we look at what we do know about how CJD can be transmitted, we'll understand why people shouldn't be concerned about contracting this disease. Creutzfeldt-Jakob disease reportedly affects around 1 person per million per year. In the United States, this translates to 280 to 300 new cases per year.
The 1 per million, I believe, is pretty accurate. And this is because it's not only that the 1 per million statistics or incidence is shown in the United States, but pretty much in many other countries where surveillance has been conducted, the incidence of CJD had remained at about 1 per million per year.
Most of the cases are classical or sporadic CJD, occurring for no as yet known reason. Sporadic CJD affects people mainly over the age of 50.
I'm a school teacher. I'm used to talking to groups of people, not to lights, TVs, cameramen.
And once clinical symptoms appear, it has a very short course. There are 6 known subtypes, all with distinct clinical and pathological features, including ataxia, dementia, and spongiform change. The sporadic form accounts for approximately 85% of the cases. About 15% of CJD cases occur in families that carry an abnormal prion gene. In those inherited or familial cases, patients are born with the gene, but the symptoms don't begin until later in life. Dina Simpson's family carries the gene and has lost 12 members of her family to CJD, including her aunt and her mother.
I had to tell her that she was dying of the family disease, which was a very, very difficult thing for me to do. And I looked at her and I said, "You know the outcome?" And she said, "Yes."
A simple blood test can discover whether a person is carrying the abnormal gene. Since Dina's mother had it, Dina got tested.
I did find out and I'm negative. And because I'm negative, my daughter and any of her children and future generations will not be affected by the disease.
The third type of CJD is acquired by infection. To transmit the CJD agent, there has to be direct contact with brain or nervous system tissue in order for this to occur.
Transmission of CJD has been documented in instances where inoculation of the brain tissue took place from one patient to another. Now, this has been documented, for example, through inoculation of human growth hormone. Human growth hormone is obtained from pituitary glands, which essentially is part of the brain. And the pituitary came from cadavers who have died of CJD, and the human growth hormone extracted from the cadavers has been shown to have transmitted CJD. This occurred before 1985, and in 1985, when this was first identified, the use of human growth hormone obtained from human cadavers was discontinued. But there continues to be the occurrence of CJD related to human growth hormone because of the long incubation of the disease. But all these patients were exposed before 1985.
Another way CJD has been shown to be transmitted is through the use of dura mater.
The dura mater is a substance that covers the brain, and sometimes it will be used in neurosurgical procedures to patch up part of the brain that was operated on. And if the dura mater is obtained from human cadavers who've died of CJD, that dura mater potentially could transmit the disease. And such transmissions have been documented in the United States and elsewhere in the world. Again, the use of dura mater has been discontinued in 1987 when it's been shown that this material has transmitted CJD. The occurrence of this form of CJD has essentially ceased because of the discontinuation of the use of dura mater grafts.
The other way CJD has been shown to be transmitted is through the use of neurosurgical instruments.
If neurosurgical instruments are used on a CJD patient and are used in another patient without proper sterilization or autoclaving, they could potentially transmit CJD. So all instances where CJD has been shown to be transmitted from person to person involve inoculation of materials that came in contact with the brain or other nervous tissues.
There are a couple of hundred cases due to growth hormone, a couple of hundred cases due to dura, and a smattering of cases due to surgical instrument cross-contamination, and 1 or 2 cases due to a cornea transplant. So that's pretty rare and disappearing.
But there are also acquired prion diseases or variant CJD that are transmitted by the consumption of contaminated material. That's what happened in the United Kingdom in the 1990s.
In the variant CJD, it's a different story. In variant CJD, the disease has been shown to be transmitted from cows infected with bovine spongiform encephalopathy or the mad cow disease. And that transmission has been believed to have occurred through ingestion or consumption of cattle products that have been contaminated with the mad cow disease agent. But that's different from the classic form of CJD that occurs in the United States.
In the U.S., a different prion disease called chronic wasting disease affects deer and elk. There is great concern about whether it may be transmitted to humans. Dr. Pierluigi Gambetti is director of the National Prion Disease Pathology Surveillance Center in Cleveland, Ohio. He and his colleagues have analyzed the brain tissue from virtually every hunter in the United States that has been reported to have CJD.
Let's take an example of a hunter who has consumed on a regular basis elk and deer meat and comes down with a prion disease. Immediately the question is that sporadic CJD or is a CJD that has been acquired by eating contaminated elk and deer meat? So we have no evidence of transmission of chronic wasting disease to humans so far.
Armed with this knowledge, patients, families, and professionals alike can care for CJD patients without fear. But the key is education.
Education is very important in CJD. Education for physicians, education for healthcare personnel who are taking care of CJD patients, education for pathologists, and education for embalmers or funeral directors. So education about what CJD is, how it's transmitted, and how it's not transmitted should be provided at every level, starting from the hospital, the physicians, infection control personnel, and also funeral directors.
Next, we'll look at funeral industry settings where you work and learn what you need to know when caring for victims of CJD.
I drove right past our street on the way home. You kind of get yourself in a preoccupied mode. I hope this isn't one of these early senior moments.
This is the face of Creutzfeldt-Jakob disease. Normal, vibrant people whose lives and the lives of those they love are changed forever. No treatment, no cure. It's a devastating situation. And as funeral industry professionals, you're called on at the end of life to comfort their families, as you would anyone in your charge. Learning that there is no personal risk to you is an important first step.
Goodbye.
Marie Kasai is a registered nurse with a master's in public health and has worked on the state and national level as an infection control professional for more than 25 years. When her mother was diagnosed with CJD, Marie and her family took care of her and went through a typical experience.
It was just progressively downhill. Every single day there was something that didn't work the same as the day before. Every day.
Bob is a funeral director, and when his mother-in-law died, he cared for her one last time.
We prepared her body, and there was a viewing, and there were the farewells, and there was never any question that this was be a contagious disease or anything of this nature. And I often reflect back and say, she died with dignity and she was treated with dignity and respect. The family saw her and were able to say their goodbyes.
That's the way it should be, but sometimes, in fact often, funeral directors are frightened by CJD because they've heard mistaken reports that it's highly contagious. Anthony Amagon was one of them.
A lot of people in our profession, from my understanding, are very afraid of CJD, and it's kind of drawn a line between us and the care that we should be providing to people who've experienced a loss of a loved one.
Those unnecessary fears can lead a mortician to tell a family their options are limited. Mr. Amagon has had that experience.
Yes, and several times, and we're going on the information amongst our peers and our educators that have told us that you'd be best served by not presenting the person to their family, and that you wouldn't do preparation or embalming, and that a closed casket would be something that they would strongly suggest. We've had information that we have thought to be reliable telling us that we need to act with that type of care, and most families have understood it that way and don't expect us to do anything that would be dangerous.
An extreme example of this is the fear that mortuary equipment will be permanently contaminated.
Hasn't been a death in...
As a consultant on mortuary technique, Bob Kasai has heard many questions about that.
If I make the CJD removal from the hospital, do I have to destroy my gurney? Can I place a CJD body in my service vehicle? If it comes into my embalming room, do I have to close my embalming room? If a CJD call is placed in my chapel, is the prion going to be airborne? Am I exposed to the liability of people coming in contracting CJD? I guess I'll have to destroy all my equipment.
The funeral home in Santa Barbara told me, oh, you're going to have to replace all of the surgical instruments, you're going to have to replace the stainless steel tables, you're going to have to replace this, that, and the other, to the tune of about $25,000, $30,000, basically rebuilding an embalming room.
Whoever said that was completely incorrect, but it's easy to understand how such fears get started. CJD is so uncommon that most funeral directors have not had much experience with it. Rumors and misinformation can make them so uneasy that they may fear to be involved, but having reliable information can address that problem. A family in a small, close-knit community in New Jersey had a long history of dealing with Sally Godfrey's funeral home, And when they discovered their daughter had CJD, the family discussed it with Sally.
We were fortunate that the family came to me ahead of time and explained that she did have this disease, which allowed me time to research it and find out exactly what it was and what procedures I should take. I was a bit taken back because of all the rumors I've heard. So I got right online and found, that there are different procedures we should be using and you can embalm and do an autopsy without a problem. Just take the traditional precautions with, a couple extra steps. But just handle it as pretty much any other infectious disease case.
She had also seen some wrong information on the internet, the sort of misinformation that has frightened many morticians.
Yes. And some of them were big letters. This is very contagious, and which I was uncomfortable at first when I did meet with this family for the pre-arrangement, and that's why I went online and did the research. But it just seemed, the more I looked into it, the more it wasn't a problem.
There are things about CJD that do lead a reasonable person to be cautious. We know it is a fatal, untreatable disease, and we know that the prions which cause it are very hard to destroy, but they are inactivated by bleach, which is used in CJD cases, and they are destroyed by cremation. So cremation is an option that is offered to the family.
Cremation is a very personal choice to a family to select. They need to be comfortable with it, and if their ethnic background, their religious belief system does not agree with cremation, it's really not our job to tell a family a body needs to be cremated, because they have to deal with that death and the disposition of that death. So the funeral home.
Sherry Reese is a licensed funeral director and has taught embalming at the Pittsburgh Institute of Mortuary Science. She now works with the National Prion Disease Pathology Surveillance Center in Cleveland, coordinating arrangements for performance of autopsies and mortuary services. She knows how important it is for providers to understand how they can deal with CJD.
Well, I actually had to go through it myself, and when I originally took the position, I needed to do a lot of reading. I needed to see what the risk associated were. I needed to look at some solid statistics to see how many cases have been transmitted, and the more data and actual facts that I got to it, the less my anxiety was.
Now she works to inform other funeral directors, many of whom have misguided fears about dealing with a CJD patient.
I would rather have an embalmer call me and say they don't want to handle it because they're scared of it, and let me try to deal with that fear or educate them enough to what the fears really are, versus one that tells me or misinforms a family that the body needs to be cremated, or that everybody, if he has an open viewing, everybody's going to be contaminated by this. I would rather not have that, because those are harder things to correct after they're out there than just an embalmer saying, I'm afraid.
For funeral workers, as for healthcare workers and people in general, fear of the unknown is powerful. And there are some publications and websites that foster such fears about CJD. Many funeral directors are under the impression cremation is mandated, either by state laws or by regulations of the Occupational Safety and Health Administration.
I have been told by funeral directors that their state laws require them to cremate the case, and that is not what a state law mandates. Where they're getting that, I'm not quite sure. The body does not have to be cremated.
I think there's a conflict, and I have yet to see a document from it in reference to the bloodborne pathogen aspect and OSHA's. I have yet to see these guidelines that I continually hear that OSHA says the body must be cremated.
In researching OSHA guidelines, there is no reference made to mandatory cremation of a CJD body after autopsy. In fact, the Centers for Disease Control and the World Health Organization both state that the body of a CJD patient can be embalmed and prepared for viewing, even if an autopsy has been performed when proper precautions are observed. What it really comes down to is exposure to CJD-infected brain tissue.
I would separate the issue into two categories. The patients are not autopsied, the brain tissue is not exposed. If the brain tissue is not exposed, there is no difference in taking care of the patients before or after death. So the same procedures that were used to take care of the patients before death could be followed up and be used after the patient has died. So taking care of dead bodies of CJD patients who have not been autopsied should be done under standard precautions.
But what if an autopsy has been performed?
Now, if the CJD body has been autopsied, that would mean that the brain tissue is exposed, and the brain tissue contains a high titer or higher concentration of the infectious agent, and those bodies should be done by following strict infection control procedures recommended specifically for CJD.
The embalming procedure as directed by the CDC for an autopsied CJD body leaves no room for doubt.
The embalming procedure for an autopsy CJD body would require using the waterproof sheeting, putting it underneath the body so that body fluids that are generated during the embalming procedure could be collected and disposed of properly. And the personnel that are performing the embalming should wear protective clothing, such as disposable gowns, disposable masks, and use cut-resistant gloves. In the body after the embalming procedure should be washed with bleach and sanitized right after the embalming procedure. All the sutures should be sealed with what's normally known as super glue, so that the sutures will not come off after the embalming procedure. And this is particularly true for an autopsy CJD body because the skull has been opened, the brain has been removed, and potentially that area that has been opened, the skull area where the brain has been sitting, is infectious because the agent is highly concentrated in the brain of CJD patients. And the suture in the skull area should be very carefully done, and it should be covered with super glue and washed with bleach and sanitized.
The protocols for inactivating the CJD agent on surgical instruments usually involve the use of hydrochloric acid, which is a chemical that has been shown to be effective in inactivating the CJD agent in combination with autoclaving or heat. However, when an operation is performed on a suspected or confirmed CJD patient, the use of disposable instruments is advisable. The detailed guidelines for these procedures are available online by following the link we provided. They cover every aspect of postmortem care.
What it is, what to do on the removal, if it's a house removal, what to do with the embalming, how to clean your instruments. There was a detailed list of what to do, and just be very careful.
Disposable kits that contain all these items are available for about $10. At the end of the procedure, everything is placed in a red biohazard bag for incineration. These standard precautions do offer added protection, and so far, no mortuary worker has ever contracted CJD.
The risk is negligible in almost all cases, and probably is zero in most cases. And if you want to reduce the risk to the absolute minimum, you take precautions. So they are doable. You can do it. It's been done. It takes a little extra time. You do use disposable instruments when you possibly can, and you get rid of them. If there are non-disposable instruments that are used in a funeral home, they can be autoclaved. They can be treated in the same way that we in the laboratory treat our instruments that we use over and over and over again.
The guidelines also contain instructions for cleaning instruments, for containment and disposal of fluids, and for disinfecting the work surfaces with bleach. It takes some time, but it works, and it's safe.
The precautions that have to be taken are a nuisance. They're not terrible, but they are a nuisance. They have to be careful.
Sherry compares calling a funeral home to calling a fire department when your house is burning.
What would you do if you called that fire person and they came and said, that fire is too bad and I'm not going to put it out, and left? CJD is kind of that fire. The funeral service needs to say, this is what I do, now how am I going to take care of it?
We're here to serve the community. We're here to deal with the families. We're here to help people in a time when they need help most.
This is still a grieving family, whether it was a car accident, whether it's this disease, whatever it is, they still lost someone. They called me to help them get through this process, the funeral process. So I just stepped in and did what I would do with any family I serve. This disease doesn't make their grieving any different or how I handled them any different.
And after learning more about CJD, Anthony Amagon is no longer fearful.
It's a surprise in a very positive way. It makes perfect sense in your explanation on a cellular level what happens that helps us understand how the disease actually evolves in a person and that it's not communicable in the ways that we always thought it was.
Another thing to consider is that not every person with CJD has the diagnosis made during life. There's a real likelihood that healthcare workers and embalmers have dealt with CJD patients without knowing it.
You could have embalmed an Alzheimer's case when in reality it could have been a CJD case. You could have done a heart attack victim, and this victim may have had CJD.
If you think you haven't embalmed one of these cases, chances are you have, because you can only be diagnosed through the autopsy.
Do I think that funeral directors have already embalmed these cases? Sure I do.
We probably have dealt with many people who have had the disease and not even known it. But it's apparent that there's not the risk there that we thought there was.
Of course, the same precautions that protect you in a case where you know the diagnosis will also protect you in all cases in which the patient might have an infection you don't know about. That's why they're called universal precautions, and you'd be well advised to use them in all cases. Whenever a patient with CJD dies, we have an opportunity to learn more about the disease. An autopsy may provide answers for the family as well as clues from medical science.
The only way to confirm the diagnosis of CJD or other related prion diseases is by testing the brain tissue. And the brain tissue can be obtained by performing the autopsy. And we strongly encourage physicians to arrange for autopsies of suspected CJD patients. And this would help us not only to confirm the CJD diagnosis, but also make distinctions between the various forms of CJD, so that we'll be able to monitor the CJD, forms of CJD that are newly emerging.
I don't want another family to go through this with no answers, and perhaps with an autopsy with my son, it'll provide answers. It'll some way find something that could stop the disease, give an answer.
The National Prion Disease Pathology Surveillance Center in Cleveland is supported by the CDC and seeks to collect and analyze specimens of brain tissue from as many cases as possible.
Tissue examination is really the way to establish the diagnosis. But then there is the other aspect, a very important aspect. Tissue is absolutely necessary to establish with accuracy the type of prion disease, and that's what we want to know.
Unfortunately, just as with other services, some autopsy providers are reluctant to perform an autopsy on a CJD patient. Dee Maiko's husband may have inherited his disease, but we'll never know for sure.
It was thought that my father-in-law had died of the same thing, although he was not autopsied, for a variety of reasons. Number one, the hospital did not want to do it for fear of contamination.
A pathologist, for example, has to assume that once he cuts that body open, he is dealing with organs that are infectious.
Of course, the same standard precautions that protect an embalmer will protect a pathologist, and no pathologist has ever contracted CJD by performing an autopsy, so they shouldn't be reluctant.
We're trying to find a provider right now in Alabama.
In order to overcome that problem, the Surveillance Center established a nationwide network of pathologists who are available to perform autopsies. Sherry Reese coordinates that service.
There are times we are able to use a local pathologist. There are times we need to transport the case somewhere out of state. We also cover all the transportation fees.
The more specimens the center receives, the more valuable the information obtained.
Autopsies are extremely important because it's the only way we can classify cases. We can identify whether a case can really pose a threat to public health. And that is the ultimate goal and mission of the surveillance center.
As stated previously, when an autopsy is performed, embalming can still be done safely, according to the guidelines. And there can be a viewing. But since the skull has been opened, relatives should be cautioned not to touch the face and hair.
I guess frustrates me from the different families I've talked to is the lack of knowledge that you can do an autopsy that you can embalm these people and have open caskets.
And so, with proper precautions, we can advance the science of CJD and serve a family's needs without the fear of contracting CJD. That's an important message for healthcare workers, funeral workers, and the families themselves. It's our hope that we've taken some of the apprehension and fear out of Creutzfeldt-Jakob disease so that you, as funeral industry professionals, can share your abilities and unique gift of caring with the families and friends of these CJD victims. Further information or assistance is available through the CDC, the National Prion Disease Pathology Surveillance Center, and the CJD Foundation. Thanks for watching.
I tell them it's Creutzfeldt-Jacob's disease and they leave me alone immediately. Nobody knows what it is.